Hello, Assalamu alaikum, and welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Now, today we're going to talk about dental health, teeth, gums. For some people, it may be a bit of a wake-up call. Many people take their dental health lightly. We shouldn't. It's something to be very, very concerned of. Many people go to the dentist when they're really, in pain, and it's sort of the last stages and the teeth are in really bad shape. Again, we're going to talk about that. Some people have phobias like me, and we're going to address all those subjects today on the program. We're happy to have with us in the studios today Dr. Abral Hussain Sayed, who's a dental surgeon and implantologist. Thank you very much, Dr. Abral, for joining us here.
Thank you. Thank you for having me.
Our pleasure. Okay, and now before we get back to Dr. Abral, let's have a look at this report.
Most people brush regularly. Many don't clean between their teeth. And some people don't have regular dental checkups. A few small changes in your daily routine can make a big difference in the long term. Your dental team can remove any buildup on your teeth and treat any gum disease that has already appeared. But daily dental care is up to you. And the main weapons are the toothbrush, toothpaste, and the interdental cleaning. That is cleaning between your teeth. Teeth vary in shape and size depending on where they are in your mouth. These differences allow the teeth to do many different jobs. Teeth help us to chew and digest food. They help us to talk and to pronounce different sounds clearly. Finally, the teeth help to give our face its shape. A healthy smile can be a great asset. And because this is so important, it makes sense to give your teeth the best care possible. Tooth decay can be painful and lead to fillings, crowns, and inlays. If tooth decay is not treated, the nerve of the tooth can become infected and die, causing an abscess. This may then need root canal treatment or even for the tooth to be removed. It is very important that you keep up a good routine at home to keep your teeth and gums healthy. The gum disease is common and, if left untreated, may lead to bone loss around the teeth. In some cases, it may lead to loose teeth and teeth being lost. The gum disease is preventable. It can be treated and kept under control with regular cleaning sessions and checkups, preventing further problems. If teeth are lost, it may be necessary to fill the gaps with bridges, dentures, or implants.
Welcome back. Dr. Abral, if I could start you with this first question, because this is we're going to have so much to talk about today. What are your concerns as a dentist when you see patients coming in?
Most of the time, actually, I think the most alarming thing is oral hygiene. People do not are aware of the implications they can have having bad oral hygiene and its effects. And plus, they do not know their brushing technique and their timing is not correct. Most of the time, all the problems arise for basic things. All the people who come to us, we always advise them, we guide them, timing of brushing, technique of brushing. But we can only guide those people who come to us.
Of course.
But, I think, in my opinion, the most important role is going to be by media. If there's regularly program on TV and social media as well, the brushing technique, timing and what to eat and what not to, and if you do not have good oral hygiene, what are the implications? People do not know that it can, if you have bad gums, it can cause heart problems, it can cause dementia, it can cause premature birth, so many problems. So that's why, as a teamwork, we also have to have close interaction with cardiologists and gynecologists. All of us, we have to tell, if a cardiologist sees a person who has got bad oral hygiene, he is definitely going to advise that take care of your oral hygiene, because you most probably became a cardiac patient because of your bad oral hygiene.
Really?
Yes, exactly.
And why is that? What's the science behind that?
Actually, these people who have got bad oral hygiene, gingivitis, calculus deposits, there are millions of bacterial colonies, in the mouth, and they produce a chemical, endotoxin, that goes into our circulation, and that roughens our blood vessels, and it damages the heart valves as well. So it's really, really very bad.
Okay.
Yeah.
So, you know, as you've just explained there, the actually mouth is the gateway to many other diseases that can take place if we're not looking after our teeth and our gums, as you said. So, you know, what are the first signs of a person having problems with their gums, and when should they go and see a dentist then?
Actually, ideally, even if you do not have any problem at all, after every 6 months, you should go for a checkup.
I think you hit the nail on the head there.
Yeah.
That's exactly, you know, the dilemma that we're often caught up in.
Yeah.
As Dr. Abraj said, you know, after every 6 months, you should go for a regular checkup, regardless of whether you're having a problem, an apparent problem. There may be something that's starting and you don't know
and
about
nowadays, we are definitely getting some patients, which for us is a little surprise, because people walk in and they say, Doc, we don't have any problem, but you just came for a checkup. And, you know, it gives you happiness that,
Fantastic.
People are,
That's a success in itself, isn't it?
Yeah.
Also the role of schools as well. Schools should also be, you know, so at childhood, placing the emphasis on children that how important it is to brush their
Lots
teeth
of
properly.
schools in the major cities, they do invite dentists for checkup, and which is a very good thing.
Yeah, it establishes a relationship. Okay, so we're going to talk about phobias as well, because that's something that, you know, I have personally experienced, that having a phobic a problem with dental work stops you from going at the right time. And in fact, it works as a vicious circle, because what happens is that you make it so much worse, but by the time you go to the dentist, maybe something that was a normal filling becomes something else.
Yeah, exactly. That's absolutely correct. You know, in my childhood, the person I used to be most scared of was a dentist. You know,
Really?
I used to, if I could see a clinic, I would run away from that place. You know, I won't even pass in front of that. That's true. But most of the time, if you ask a person who's scared of visiting a dentist, there is a traumatic experience in the childhood, most probably, most of the time. So that we are very careful, and when children come to us, the most important thing we do is we develop friendship. We do not jump straight away to the treatment unless until it's an acute emergency. We let the child become very friendly with us, develop confidence, develop friendship, and we make sure that we try to do pain-free dentistry for them. So with the passage of time, they start trusting you so much, they let you do all the treatment.
That's fantastic.
Sometimes people, parents, they drag children, child is crying, and they say, no, you do this treatment right now. And we tell them, please, just relax, This is the child's first experience to the clinic. Let us handle this child, So we calm down a child, we develop friendship. It's very, very important that child is, very friendly with you. Is not scared of you anymore.
Of course, because that's that time that you're establishing trust, and and that's exactly the traumatic childhood experiences you just mentioned. That would, that's fantastic. Okay, now you spoke about making the process as pain-free as possible. What steps are involved there?
There was a time that topical anesthesia was not available, so we used to have direct anesthesia, but now we have topical anesthesia, we have spray, we have gel, anesthetic gel. So the pain of the prick is less now.
Right.
So, and we also give in small divided doses so that, patient doesn't feel too much pressure or pain. But, it depends upon the handling as well.
Of course. And these are all techniques that, everything added together, of course, makes that experience so much less, stress-free. So that's really important. Okay. Now, as we are, there's a huge, vast issue that we're going to talk about today. Now, let's talk about diet. Diet for healthy gums and teeth. What should it be?
Actually, any food which is sticky, that sticks with teeth, like chocolates or these bakery products, this fast food is bad. If you are eating such thing, it's better brush within 20 minutes. Because if the food keeps sticking to your teeth after 20 minutes, the bacteria in the oral cavity, they start converting that food particles into acid, and that starts demineralization, of the enamel, and the damage starts. And this is that's how these carious lesions, are formed.
Right. What should we prefer in our diet?
You know, actually, vegetables and course meals. These are, you know, and especially, of course, the home food is always good for your teeth.
And fizzy drinks is
Fizzy
a
drinks
no-no.
are not really good at all. You know, it's not only bad for your enamel, for your teeth, but for general health as well.
General health as well, absolutely, that's true. Okay, now let's start at brushing techniques.
Yeah.
How often should a person be brushing, and will one brush suit everybody?
Depends, you know, it depends upon if you're having braces, you're going to have special toothbrush for braces, and sometimes some people have huge interdental gaps. Then, you know, one brush is not enough. You have to use regular brush, and then you have to use interdental brush, and you have to do flossing as well. So a regular brush cannot remove food which is trapped between the teeth. You know, you can clean the surface, but you know, in those situations, we always you know, write down these devices for our patient. We tell them, bring them over. We teach them how to use interdental brush or how to floss your teeth. And personally, I use rotary brush instead of manual, because that's easy to, you know, you can reach all the areas. So the object is that all the surfaces of the teeth should be cleaned.
Right, okay.
So with that electric brush, which is rotary, and it's easy to,
that's
you know,
better. Okay, right. And we should be brushing morning and night?
Exactly, in the morning after breakfast and before going to bed. Especially the night brush before going to bed is the most important one.
Right. Okay, is there any instances of people overbrushing?
Indeed. Sometimes we get patients who have been using hard brush and with the horizontal technique, and they brush so hard, they literally abrade the surface. There are literally cavities, and we have to do fillings. And we tell them,
from brushing their teeth,
from brushing, you know, they abrade so much. There are huge cavities, you know, and you know, so we tell them, please, you know, treat them nicely. Don't be so harsh with your teeth. You just have to use soft brush, and with normal technique, do not exert too much pressure, and modify your technique as well.
Okay, so as we were mentioning before, you were mentioning gum disease. What are the signs and symptoms of gum disease?
Usually people they get alarmed. The first sign is bleeding. You know, when a pink brush, when they brush their teeth, they notice that, oh, there is blood coming from the gums. And then they come to us, and then we tell them that, well, it's your body which is trying to tell you something is wrong with me, treat me. So for example, if a person has a renal stone, and if you don't get pain, you don't notice it, and you might lose your kidney. So these are the signs that your body is telling you. So similarly, your gums are, when they are inflamed, so you know, they are telling you, please treat us. And you know, they come to us, and then we find out the reason, what's going on. Most of the time it's bad oral hygiene, and sometimes there are some other reasons. So we work accordingly.
And it's something that has to be taken very seriously,
Absolutely.
of course. Okay,
Yeah.
Is that also a reason for, or maybe other reasons as well, for bad breath?
Indeed. You know, if you have, for bad breath, there could be local reasons in the mouth, and there could be certain diseases in your body that cause this bad breath. So when a patient walks in, the first thing that we notice is, and we check, is the reasons in the mouth. If a person has perfect oral hygiene, everything is fine, then we look for certain other diseases. Then, you know, when we, you know, go for those, and then we advise certain tests, and then we also seek the help of the medical specialist. That we suspect that this person has got this problem.
Right, okay.
But most of the time it's the reasons in the bad oral hygiene, bad gums, you know, and especially people who are working, the working class, they drink less water. If you are drinking less water because you are working, and most of the people, they tend to drink less water. So that's another very major reason of bad breath is drinking less water.
Okay, right. At what age should children start seeing the dentist?
The moment their teeth erupt.
Oh, little children as well?
Yeah.
Really?
Yeah.
And what is the reason for that?
Well, you know, in children, most of the time it's we call it bottle caries, most of the time they sleep with the bottle in the mouth, and so that causes gingival caries and food sticking to their teeth. So that's the time that we should guide parents that before the child sleeps, gently clean the teeth before,
Right.
And do not leave this bottle in the mouth while the child sleeps.
Okay.
Yeah.
So a very young child, maybe a year old,
Yeah.
how do you get them to brush their teeth? What are their guidelines?
Well, it's not necessary that the child brushes, and the mother can also help. With a very small brush, the mother can also hold child's hand and they can work together.
Okay, so in our area of the world as well, we have people eating a lot of barn
Yeah.
and things like that. What implications does that have?
The
on health?
highest incidence of oral cancer is in subcontinent, all over the world, because India, Pakistan, Bangladesh, because over here people use palm, nuts. We call it chalia, and
Tobacco.
it causes fibrosis, it causes oral cancer. So once again, there comes the role of media once again. If we keep showing these cases on these TV screens, cases of oral cancer, and this is the reason I think most of the people, they can be educated.
Right, and those barn masala, those little
Yeah,
sachets you get,
they should not be available at first place,
Right,
but even if they're available, if people are aware of the dangers, I think they are going to avoid it.
Right. Okay, so now let's talk about sensitivity in teeth. Exactly what's going on there?
Most of the time, it depends upon the age of the patient. Sometimes people are brushing so hard. Sometimes the people have, at advanced stage, they have brittle teeth. So there are some micro cracks in the surface of the enamel, and the dentinal tubules are exposed, and their movement of the fluid in the tubules causes this sensitivity. So nowadays, luckily, some medicated toothpaste and mouthwashes are available, and they are quite handy, they are quite helpful, and we start with those, and if they don't help, then we have certain other techniques, certain other treatments available for sensitivity that we carry out in our office.
Right,
Yeah.
and those are sort of like coatings, veneers for the
No,
teeth?
well, veneers is for cosmetic reason, that comes in cosmetic dentistry. But you see, there are certain you can do fluoride application, and you can do certain medication you can apply on teeth for sensitivity, and people can wear kind of trays, on their teeth, loaded with that medication. So we
Right.
carry out such treatment in the office.
Okay. Cosmetic dentistry, you just mentioned that.
Yeah.
What is available in cosmetic dentistry? What do we see a lot of?
Yeah, you see, all over the world now, people are crazy for Hollywood smile. Everybody wants a
Right.
Hollywood smile. They want their teeth to look bright white. And it's a craze, especially amongst the youngsters. And they want it.
What is that process, and does it in any way damage the teeth if you do it too much?
Sometimes even just whitening is good enough. But sometimes people have bad teeth, twisted, crooked, or damaged teeth, discolored. So in that case, we can go for veneers or lumineers, and sometimes we have to go for ceramic crowns. Yeah.
Right. Okay. So the process itself, though, the whitening, can that be if a person is doing that too much? Because there are some over-the-counter things available as well. You see sort of things like whitening treatment for teeth. What would that be?
Actually, it's always good to seek professional help. Even if you buy something over the counter, you can always consult your dentist that should I use it?
Is that
if
okay
it's
to
safe,
use?
you can definitely use it. But certain things which are harmful for enamel, for your teeth, and excessive use is also harmful. So that must be avoided. So it's always good to seek
Right.
professional help.
Right. As you're an implantologist, tell us what that involves.
Well, I always say that it's literally sitting in a time machine and going back to the time when you used to have your own teeth. Lots of the time, people come without teeth, and can you imagine a person who has got no teeth and after this treatment getting back fixed teeth again? in the mouth and getting the ability to chew food. So it's a miracle. It's a miracle. You know,
So 32 teeth would be replaced.
the teeth which are replaced are 28. Wisdom
28,
teeth are
okay.
not replaced.
Okay, okay, right. So what does that procedure involve? Are there lots of visits to the dentist's
Not
office?
really. You know, first of all, the patient, there's a criteria. The patient has to be a good candidate for an implant. You know, we have certain criteria. Once
what's
we
that?
consider that patient is healthy and is good enough and is a suitable candidate for implant, there are certain diseases, you know, we have to rule out certain diseases. And once a candidate is selected, you know, we measure the size of the bone, and then we decide which size of implant. Implant is basically a titanium root, you know, and we place in the jaw, either upper or lower jaw, and bone has affinity. Bone loves titanium, and it grows around the implant, you know, it takes into grip. We call it osseointegration, and once implant is successful, you can fix regular crown on top of that, and the patient gets back the chewing ability.
Fantastic, okay. Braces.
Yeah.
There's been lots of advances made in braces as well.
Yeah.
Before, you know, a couple of years, quite a few years back, you just see really a lot going on
Yeah.
when you're talking about braces.
Yeah.
Now there are different things available as well.
Yeah.
What are those?
Well, the latest is invisible braces, you know, and people are loving it because there are lots of people who are adults and they don't like wearing braces, you know. And the biggest advantage is that your braces, you know, you're wearing your braces, you're hanging out with your friends, or you're carrying out your official duties. Even if you're a media person, but your braces are not showing on, you know, nobody can see them.
Right.
But, you know, these invisible braces have some limitations. Not every case can be treated with invisible braces.
Okay.
There are lots of cases where you have to use regular braces, but there you have you know, tooth-colored braces and metallic. So it depends upon the age and profession of the patient. But all these things are available. Now, there is no age limit for braces.
Right, okay. So we'll get back to the program. Right now we're going for a break. Don't change the channel. Okay. Welcome back to the program. Today we're talking about dental health, and you know, Dr. Abrar is with us and he's giving us all this important information and so much advice and tips on how we can care for our teeth and gums. Tell us, Dr. Abrar, healthy teeth and gums, is this something you can also inherit? Is it genetic as well?
Genetics definitely has its role. Your immunity is one of the factors that determine your caries, because in Africa there are certain tribes who never brush their teeth, and yet they do not have any caries because they have such a strong body immunity.
Right.
Yeah.
Would that also be part of the related to their diet as well? Could
Indeed.
it be?
Yeah, because they eat coarse diet. They do not have access to these sticky foods, you know. So it's a major factor, yes.
Tell us about children coming in with multiple cavities because they're having lots of chocolates and sweets and things like that. Tell us about that.
Well, unfortunately, most of the children, they have this problem because any relative who visits, you know, close ones, they buy chocolates and then, you know, they give them as gift to children. And it's natural, you know, there's a lot of craving for that, and children do fall prey to that. I think the most important responsibility comes from adults, parents and relatives who are visiting family. They can buy something else other than chocolates and toffees or candies or something, or bakery products. It matters, and even if we can always educate children that if you are eating such stuff, you have to immediately brush your teeth, like within 20 minutes.
Right. Because I remember, throughout childhood, when somebody would give you a chocolate or you would be eating them, there would always be one responsible adult saying, that's going to ruin your teeth.
Yeah, indeed.
But you hardly hear that anymore, do you?
Indeed. Yeah, because, when children come to us and you see a lot of cavities, I ask them, who has been bringing these chocolates home? And they say, one of the parents.
Yeah. It's true.
Most of the time it's the father, the dad, who's bringing chocolates home.
Again, because you don't really mentally connect. It's not on top of your mind to think that, okay, I'm buying this right now for the kids, it'll make them happy, but in the end it can wreak havoc with their health.
Yeah.
That's very true. Okay, pregnancy.
Yeah.
And dental health.
Yeah.
What are the signs to look out for, and how should a woman be more cautious when she's pregnant?
Yeah, sometimes during pregnancy there are some hormonal changes in the body, and some women do get inflammation in the gums. That's all right, but if this inflammation is already there because of bad oral hygiene, because of calculus, there are some pockets and a lot of areas where there's gum recession or inflammation in the gums, that woman has to be very careful, because bad gums can cause premature birth.
As you mentioned at the beginning of the program, so that is something that is very important.
Yeah.
Should she be going for extra checkups or what?
When these ladies, most of the time they go to gynecologist, and if a gynecologist notices that this woman hasn't got good oral hygiene, they must refer that lady to the dentist and give a warning that you must improve your oral hygiene. Otherwise, it can cause, it can create some complications regarding pregnancy.
I mean, as you mentioned, the heart issues as well, and this as well. So this is something that's very serious. A person needs to take notice. Calcium and vitamin C, we hear a lot about that regarding your teeth and gums. What role do they play?
Definitely, vitamin C overall increases your body immunity, and it's very good. If you have got strong immunity, it helps against caries. Caries is basically infection of the heart tissue. It is infection. So if you have strong immunity, it helps you. And similarly, calcium is very important for you, not only your teeth, for your bones as well. This is important, and but they have to be taken in consultation with a medical specialist sometimes. Sometimes you have to be careful not to take overdose. If you are a heart patient, you're taking certain other medications, so it has to be, the dose has to be adjusted.
Right, so that's not something that anyone can just take into their diet. They have to have professional help as well. We have a problem with self-medication.
We do have.
Do you see that a lot in your field of work as well, where somebody's had a bit of a sore tooth, and instead of coming to the dentist, they've been taking
usually
tablets?
The first person they visit is the medical store guy.
And give me something for my pain relief.
Yeah.
Okay.
And most of the time the medicine they take is not suitable for that kind of infection. There are certain antibiotics which are suitable for specific infections. Not every antibiotic covers every infection of the body. There are certain specific areas you need specific antibiotics for that. So it's always good to seek professional help.
Now, many people complain about the costs of dental work. And they say, oh God, it's just going to cost so much. So let me save up a bit and do this later or whatever. Why is dental work so expensive?
Actually, all over the world, there, barring few countries, this treatment is not offered free. Even by the government sector. The products and machinery and lab, work and all that, they adds to the cost of, dentistry. So if you are trying to maintain good standard, a real international standard, then if you make comparison, charges in Pakistan are far, far below. You know,
In fact, you have many people coming from abroad to have their
indeed,
dental work done in
that's
Pakistan.
Yeah. Even lots of diplomats, they love to get treatment in Pakistan because way back home it's very expensive.
Sterilization.
Yeah.
What are the concerns? And when you visit a dentist's office,
Yeah.
what should you be worried about?
Very important question. You know, actually, for us now, we are very happy that lots of people, they are concerned, they are aware of sterilization, and we always encourage, you know, we tell people you have the right even to check the sterilization room and ask us questions. We'll be quite pleased to tell you different stages of the sterilization. Most of the things that nowadays we use are disposable, and there are certain things that you cannot use as disposable. You have to, you know, sterilize them. So all of the things that, you know, are sterilized, you will always see them in a pouch. You know, there's a special pouch of you know, we use in sterilization. And but the good thing is now people are becoming aware of this thing, and its implications are very serious. It can cause very serious health problems later on if you're not careful about that.
What can those problems be that you can get from
the most notorious
poor
one are
sterilization?
hepatitis, you know, hepatitis B, C, and you know, and even you can contract AIDS, you know, if the instruments are not properly sterilized. So you know, one single miss and you have a lifelong problem. You know, so it's very, very important to have very strict standards of you know, sterilization.
As you mentioned before, you know, in the start of the program, you said that media awareness is something that is very, very important. What would you like to get across as a message, like right now you're sitting in this program? What would you like to tell the viewers?
The most important thing I would like me to tell people is maintenance oral hygiene, their brushing timing, technique, and of course sterilization. You know, we'll be quite glad to, if any media team can visit us, we can tell them, well, these are the steps of sterilization, and that's how a sterilized instrument or pouch should look like, so that when people walk into any clinic, they can always look for those things, because it's your life by the end of the day.
Absolutely.
And so you cannot afford to have anybody showing any negligence. I think once the masses are educated, it can also add, you know, responsibility to the professionals. They can be even more careful that, yeah, well, you know, people are walking in, and there is no harm if a patient walk in and say, doctor, can I see your sterilization facility? You know, you should always welcome them. Say, yes, sure, why not? Please come over. Let's show you. And that's how we carry out our sterilization. And these are our sterilized instruments. And that's how they, you know, they are supposed to look like.
Right, true. Okay, other procedures as well. You know, you have your fillings, the usual normal, the first step for when a person comes in to the dentist office if they're going to have any procedures. Has that changed as well, the way fillings are taking place?
Oh, yeah, definitely. You know, previously it used to be, you know, drill, you know, grinding, you know, and cleaning the cavity and filling it. Nowadays, even laser is coming in, you know, although it is not very sophisticated or refined. Laser technology still has got a long way to go, but they are being used now. They are becoming quite popular in dentistry. In soft tissue, they are very good. In hard tissue, they are coming up with lasers. You know, in future, you're going to have quite a few lasers, you know, filling the cavities, cleaning it with laser, and then filling it up.
Oh, right.
Yeah.
So other than lasers, what is the sort of different techniques for fillings? The different materials used?
There are lots of different materials. There are different indications. Sometimes we have to do a medicated filling. You may call it a temporary filling, depending upon how deep the lesion is, how close it is to the nerve. And then we have lots of materials for permanent fillings. We have used to have silver fillings, amalgam filling. Nowadays, we have tooth-colored fillings. And even in tooth-colored, there are lots of materials available. So a lot of variety available.
Right, okay. What exactly is a root canal? Because when you hear that from someone, or you know, you hear that somebody's actually, it sounds like a bit much. What is going on?
Actually, root canal is an attempt to save a tooth which is otherwise slipping out of your hand, you know. So sometimes the tooth is so painful, you know. The first thing a person would like to have is a relief from pain.
Oh, yeah.
So either you extract that tooth or try to save it. So naturally, you know, everybody would like to say that's save it. So it's a very useful procedure, you know. It relieves of pain and saves your tooth, and can be used for the rest of your life.
That is something that, you know, once you've passed the stage of a filling,
Yeah.
and you want to save the tooth, then you go in
Exactly.
for a root
Yeah.
canal to
Yeah.
save that.
Yeah.
Okay. Bridges, what are those in dentistry?
Bridges are, you know, if a tooth is missing in between the teeth, you know, we use the adjacent teeth for sport, and we place them, you know, if one tooth is missing, you take support from the adjacent teeth, and then 3 teeth are fixed. But now we have a choice as well, you know. It's not necessary to fix a bridge. We can always go for an implant, you know. An implant
right.
can be placed.
Right. What sort of consequences do you see if a person has a bridge hasn't been fitted in properly?
Yeah, it can definitely lead to gums problem. It can lead to carious lesion in the teeth. It can lead to pulpitis, pain in the teeth, or sometimes if there are deep pockets and bone loss and teeth become mobile, the patient may lose teeth as well. Yeah.
Okay. Extractions.
Yeah.
There are different sort of, well, I'm not a medical person, so I'm just giving a layman's sort of perspective. Sort of, you know, an easier extraction, then you have the surgical extractions as well. What is needed for a surgical extraction? Is it a lot of care after the extraction when a patient goes home? How do they look after it? And what should be the...
Yeah. You know, usually the most the time the tooth which needs surgical extraction is the wisdom tooth. But sometimes other teeth, they are damaged so much that you just cannot pull with the help of forceps. So we always prepare the patient. We tell, well, look, you're going to have a surgical extraction. Our job is to make sure that you do not feel any pain.
Right.
It's atraumatic, and it's smooth, and in surgical extraction, you know, you have to remove part of the bone, you know, to remove a tooth. So obviously, you know, after that there is more care is required. Sometimes we should expect post-operative swelling or a little bit oozing of the blood. So we always educate and prepare the patient that this thing is you should expect. So don't panic, you know, if at all this thing, and naturally patient is on medication. So there are certain instructions that we tell them, well, when you go home, you have to follow these instructions.
What are those instructions?
Usually, you know, the first mistake people make is they do a lot of rinsing. So we tell them after extraction, at least for 24 hours, do not rinse. Because if you rinse again and again, you disturb the blood clot, you know.
And you need that blood clot.
Yeah, indeed, for healing. And for, you know, if there is the blood clot is disturbed again and again, you're going to get a lot of bleeding. And then they come back, they say, well, you know, my bleeding has not stopped. It is not going to stop if you have been rinsing or spitting again and again. So we tell them, you know, you have to keep pressure packing. And if at all, sometime there is oozing from the socket, surgical socket, keep pressure packing. And you can take ice cream if it's permitted, and soft food for a couple of days. Yeah.
Ice cream seems to be synonymous
Choice
with
number one. Yeah.
dental extractions, and you know, when people are having pain as well,
Yeah.
they seem to go for that. Okay, Dr. Brown, thank you so much for joining us
Thank you
today
very much.
on the program. You know, it's been wonderful speaking to you, and I'm sure many
Same here.
people's queries and questions have been addressed. And the most important thing, as you have done, is to raise the awareness for people to take care of their
Thank you very
oral
much.
health.
It's my really pleasure and honor that I've been here. I sincerely hope that some people do listen to us.
They will, definitely, they will. Okay, so we come to the end of today's program, a very, very important one, because I, being a person who has suffered from, you know, dental phobia, I know how bad it can get if you don't go and see the dentist in time. So, as Dr. Brown said, 6 months After every 6 months, you should be visiting the dentist, whether you have a problem or not, so that he or she can make sure that you are in optimum health. Until next week, stay happy, stay healthy. Bye-bye.